An easy and convenient setup is the key to the usability of the SimpliCT. Roll the unit close to the CT table and swing the horizontal arm over the table by pressing the turning knob on the base. Remember to close down the brake prior to aligning the system, thus avoiding pushing the unit out of alignment, as can be the case if done reversely. Align the unit by slightly twisting the base with your ankle, keeping your foot firmly placed on the floor. The line laser should be parallel to either the edge of the table or the CT's midline laser marking. The SimpliCT's position on the floor is dependent on the puncture angle. The flatter the angle, the further from the floor the unit should be. Be sure to communicate with the radiologist during the calculation to avoid having to reposition the SimpliCT. If the unit is placed away from the table, the line laser can be angled by turning the angle input wheel to raise the line so it illuminates the edge of the CT table, making the alignment possible. As routinely done in all CT rooms, the patient is marked, scanned, and a slice with the best access to the lesion is singled out. The angle and distance to the lesion from a specific skin entry point is calculated. Re-entering the room, the chosen skin entry point is marked. The SimpliCT is powered on by pressing the green on-off button. And the axial plane is chosen by pressing the XY button. The calculated angle is then entered into the SimpliCT by rotating the angle input wheel. The SimpliCT's pointing laser will angle out to the set angle, and by moving the laser unit, the laser dot should be brought towards the skin entry point and placed directly superimposing it. For small adjustment, use the fine-tuning wheel at the rear of the laser unit. Using the SimpliCT when applying anesthesia, one can precisely anesthetize the puncture tract. After marking the depth of the needle, the introducer needle should be slightly entered into the subcutaneous tissue before the needle hub is raised to align it with the laser light. Alignment is obtained when the needle hub is illuminated by the laser dot. The needle is then advanced to the target by keeping the laser dot at the hub of the needle. Please notice how the needle is advanced in one step to the appropriate depth, without the need for in-between control images. The patient is moved back into the CT and the control image is made to verify the correct position of the needle. Remember to control the image before the sample is taken. With the introducer needle in the right spot, one can begin sampling tissue from the lesion. Please note that the exact same procedure would be helpful for any CT-guided intervention with straight needles or introducers, such as drainages, pain management techniques, or RF ablations. If double angulations are necessary, simply dial in the corresponding gantry or cranial caudal angulation. This is done by pressing the G button and turning the angle input wheel until the angle of the SimpliCT matches the angle of the gantry tilt. make sure the cranial caudal orientation is correct. Move the laser unit so that the laser dot is directly at the entry point by using the fine-tuning mechanism. The procedure of placing the needle in line with the laser is the same as with a simple angulation. Hence, SimpliCT is making it much easier to do double angulated procedures. When, during positioning, the SimpliCT's display is found to be facing the gantry, it is easy to slide the unit off the rail, turn it around and re-enter it so that the display faces the users. When preparing for a lateral procedure, first align the unit with the edge of the table, then slide the laser head down to the vertical rail by releasing the brake handle. In this position, the SimpliCT can be used for any lateral procedure, allowing the patient to be in the most comfortable and stable position. The SimpliCT can be angled 45 degrees to either side, and as such can accommodate for any entry angulation, covering 270 degrees around the patient. Again, notice how the needle is placed in line with the laser light when the dot is illuminating the needle hub. Let's go through the various steps one more time. When positioning the SimpliCT, make sure to close the brake prior to aligning the unit. Align the unit with either the edge of the table or the CT laser midline marking. Image the patient. Calculate the angle and distance to the target, and mark the insertion point. Dial in the appropriate puncture angle before positioning the laser dot onto the chosen entry point by using the fine adjustment wheel. Mark the puncture depth on the introducer needle and place the needle tip exactly on the entry point. Raise the needle until the laser dot illuminates the needle hub, at which time the needle is aligned. Enter the needle in one swift motion to the correct depth, keeping the laser dot at the hub of the needle before scanning the patient to make sure the needle is placed correctly. When this is verified, the sampling may take place. If angulation is required in two planes, enter the appropriate cranio-caudal angulation in addition to the angulation in the axial plane. Then align the needle with the laser dot at the hub of the needle. If the display is towards the gantry, simply turn the laser unit around so that the display faces out. Make sure to align the unit with the edge of the table before releasing the brake handle and move the laser unit down the vertical rail. Keep the laser at the hub of the needle when advancing the needle towards the target.